Hello, I'm Dr. Waples from Restor Medical Spa, and welcome to our fourth installment of our four-part series on the aging process. Just to quickly recap, the aging process is not one thing that's happening to the skin and the face. It's actually a culmination of four separate processes that are going on in everyone all the time. The first of those processes is dynamic aging, which is caused by muscular contraction. Generally speaking, that's the wrinkles of the upper face from the cheekbone to the hairline. Because it's caused by muscular contraction, it's treated with muscular relaxation, that's your Botox. When you start talking about the lower face, it's a different process. That's volume loss. And volume loss leads to hollowing underneath the eyes, lines around the nose and mouth, and it's treated by volume replacement, which is done with dermal fillers such as Juvederm or Radius or Perlane, things like that. The third part of the aging process is intrinsic skin aging. And that is just the wear and tear that happens to the skin itself, just from, life. It leads to changes in skin tone, quality, texture, and pigment. So the brown sunspots and age spots that start to arise in the skin, that's the intrinsic skin aging problem. The way that skin starts to appear dull and coarse, the pores become more evident, that's the intrinsic skin aging process. And the fine lines, and so that crepe papery kind of wrinkles that occur all over the face, everywhere, that's caused by loss of collagen in the subcutaneous layers of the skin, and that's an intrinsic skin aging process as well. The good news about those processes, totally reversible and preventable with appropriate medical grade skincare and laser treatment. Of course, we talk more about that in some of our other videos. But the fourth part of the aging process, and what we'll be talking about today, is skin laxity. Now, skin laxity is exactly what it sounds like. It's skin that is just under the effect of gravity, slowly starting to sag. And you start to see this in your late 30s, 40s, and then of course it goes on over time. The places where you're going to see skin laxity occurring first is primarily around the eye and in the jawline. You'll start to see it up here in the upper lid where the brow will start to come down a little bit and you get excess skin that makes the eye kind of appear tired. You see it underneath the eye where you're going to see fine lines and creasing and wrinkling appearing in the skin underneath the eye. Just because the skin around the eye is very, very fine, very thin, does not have a very good bony support system like some of the rest of the face does. And so you start to see that process occurring around the eyes really first. Then you're going to see it in the jowls, around the jawline where the skin starts to kind of hang off the chin and off the jawline a little bit. And of course the creasing and wrinkling in the neck. Those are the primary places that you see skin laxity. It can occur anywhere in the body, and we also see it in elbows, we see it in knees, you'll see it in the décolleté, and of course if you have had children, you can see it in the abdomen, the skin of your stomach as well, which is very attractive. But the good news is that all of this is treatable now with non-surgical means. Now, it used to be the case that when you had skin laxity, the only real option was surgery, because you're dealing with very deep layers of the skin and even with the muscular layer underneath the skin, and it's just too deep under the skin to get to through non-invasive means. The only way you could do it was surgery. And surgeries did a good job, and surgery is a wonderful thing, but it does have downtime, it does have all the risks associated with surgery. And over the last, really only in the last 5 to 8 years, have we had the technology to treat this kind of skin laxity with non-surgical, non-invasive means that create no downtime, which is really a wonderful breakthrough. So we're going to talk a little bit about that. And I'm going to show you a picture of what the skin layers we're talking about look like so you can get a better idea of exactly what's going on down there. So this is kind of a cartoon version of what the layers of the skin look like. Up here on the top is your epidermis and your dermis. This is the top layers of the skin that if you have problems up here, such as tone, quality, texture issues, pigment issues, you're going to treat those with lasers, with medical grade skincare. When you get down underneath here, you've got your subcutaneous fat and you've got your muscular and collagen layers deep underneath the skin. And this is where laxity occurs. Laxity is going to happen down here. So the way that you treat these, the best technology to treat these is ultrasound. And that the trade name for this is Ulthera, but ultrasound is the technology that you use. And basically you use that ultrasound to create heat in the lower layers of the skin that cause the skin to contract and tighten. And I'm going to show you a couple pictures of what that looks like. So down here you see a couple before and after pictures. And you can see exactly all the things that we're talking about. These are all pictures of treatment of the neck and jawline. But you can see the skin in the jawline here in the before pictures is becoming loose. You're having all these wrinkles and this pulling down, which is of course caused by gravity. Then after treatment with ultrasound, which tightens the skin, you can see that all of those things are decreasing. I'm going to show you another set of pictures that detail the eye. Here again, you can see in the before pictures all the things we talked about. The brow coming down slightly, causing this creasing of the skin, which causes the eye to appear kind of tired, right? And then underneath the eye, again, sort of all those crepe-papery lines that are happening underneath the eye. And then in the after pictures, you can see if you tighten that skin, you can get a really rejuvenated, refreshed look. This is a wonderful therapy that is non-invasive, really no downtime, and gets right to the root of the problem, which is that skin laxity. So just to recap, if you have problems in the upper face, generally speaking, that's a Botox issue. Lines underneath the eyes, hollow underneath the eyes, lines around the nose and mouth, treated with volume replacement with fillers. Problems to the intrinsic, the skin tone, quality, texture, pigment, that's lasers and medical grade skincare. And then of course if you start to have laxity around the jaw, loose skin around the eyes, treated primarily with skin tightening technology. If you want to discuss any of these things in more detail, again, I'm Dr. Waples. You can call us anytime. Consultations with me are always complimentary. And thank you for watching our videos.